Right. Well, so we know from the phase 3 trials of ozanimod that it's effective in relapsing remitting MS in reducing relapses and also reducing MRI lesion activity. The other issue is that over time the MS disease process evolves, in part due to age, which affects the immune function, the susceptibility of the nervous system to inflammation and inflammatory damage, and also the resilience of the nervous system. As we get older, our body is less resilient. The other issue is that the benefit of medications and potential adverse effects of medications may change as people get older. So the main purpose of the analysis is to look at whether the long-term benefit of ozanimod differs as a function of age. The study involved RADIANCE and SUNBEAM phase 3 trials, who then continued into a long-term extension study, the so-called DAYBREAK study. Overall, the study comprised something over 2,000 participants. Some followed for up to 8 to 9 years total. And in a nutshell, what those results showed was that in the participants who were treated with ozanimod from the beginning in the core trial and then continued on ozanimod in the long-term extension study, that there was continued benefit on relapses. They remained at a very low level. There also was a very low level of MRI lesion activity, continuing from the phase 3 trial through the long-term extension. In those patients that were treated with interferon initially, interferon beta 1A, there was somewhat less benefit on relapses and MRI lesion activity in the core trials. As those participants transferred to ozanimod in the long-term extension, the effects on relapses and MRI lesion activity increased and reached the same level as those patients that had been on ozanimod previously. And then the main point of the poster was that when we looked at those results as a function of age, looking at patients that were less than 25 years of age, 25 to 35 years of age, 35 to 50, or older than 50 at the beginning of the study, that those very same effects were seen. There was very little difference in the groups based on their age. So those were reassuring results. There are other studies looking at safety, which is not a topic of this poster, but they also looked good. So that's very reassuring. It means that we can feel comfortable using ozanimod irrespective of the patient's age. I mean, the main limitation, as is true of almost all long-term extension studies, is that there is not a comparison group. In this study, all the participants in the extension were on ozanimod, so the results have to be interpreted with that in mind.